Hello, this station will be about anorexia nervosa assessment of prognostic factors. In this station, you need to appear that you have a specific checklist that you are going to assess presence of its items with the patient. I don't mean to be checklisty while dealing with the patient because you need to be reactive to what she is telling you. But I mean, in this station, you are not taking history of anorexia nervosa as an eating disorder, but you are asking about specific issues that determine if the prognosis of this patient will be good or bad. So, the way of collecting information here is different than the way of collecting information in history taking, and you can divide the items you are going to ask the patient about in 3 groups. The first group is items related to the illness itself. Factors related to the illness and its nature can determine if the prognosis will be good or non-favorable, like the onset of the illness, if it was late or early in patient's life, also the course, if the problem was present most of time or just it came in episodes of short duration with complete recovery in between, and also the amount of weight loss the patient experienced during the illness, presence of amenorrhea and the duration of it, and also presence of bulimic features can determine the prognosis. After assessing all these items related to the illness, you can make a signposting to the patient to tell her, "Thank you for sharing all those information about the nature of your illness. Now I'm going to ask you about your social life, focusing on your important relationships with your family members." And here, you can ask her about the nature of her relationship with her family members in the past, and also if there is any ongoing difficulties in those relationships, and also if there is any social stressors she is currently experiencing. And then you need to transfer to the third part. I mean, to ask her about factors related to her as a person. You need to ask her if she is experiencing any other problems. I mean, mood disorders, psychotic disorders, or anxiety disorders. You need to ask the patient about the type of her personality. And as we all know that anorexia nervosa is linked to the type of personality who is anxious, because as we all know, anxious persons are more prone to experience anorexia nervosa in comparison to people who are impulsive in their personality, who are more prone to experience bulimia nervosa. And after assessing comorbidities and type of personality, you can close the station by telling the patient, "Thank you for sharing all those information with me. And from what you have told me, it's clear that you have many factors that are making the outcome or the prognosis of your condition good. On the other hand, some factors make it unfavorable. In another session, I can sit with you to tell you in details the 2 groups of factors. I mean, the good prognostic factors and the bad prognostic factors you have. And it's essential during collecting the information from the patient to be reactive to what she is telling you. For example, if you asked her about comorbidity and find that she doesn't experience any difficulties apart from anorexia nervosa, it will be a good chance to say something like, "Good to know, great, fine." This will be helpful to show that you are not just information taker, but you are a clinician who is dealing with a human being who is in difficulty, and you are caring about him. And thank you.